I'm Gerald Fox here at the University of Phoenix College of Nursing. I am the Nursing Center Simulation Lab Technician. Much like an airline pilot goes through simulation so they know what the worst case scenarios, how to handle those up front, that's what we do here, is put the nurses through the worst case scenarios. In the clinical environment, they might not have an opportunity to see something. Well, here we can create it so they can see it and perform it over and over and over again until they get it right.
The simulation lab is something that I wish I would have had when I had graduated from nursing school, because the opportunities that they have in the lab are phenomenal.
It isn't until they graduate and they go out to work as a nurse that they suddenly walk in, and that's the first time they're learning about that patient, and they have to take care of them. So in the immersive simulation environment, we've created this wonderful, fun, safe environment where they care for a mannequin that becomes a real-life patient to them.
This Nursing Center Simulation Lab, it is a replication of a hospital environment. What you're seeing right now is my little Wizard of Oz control panel. With the computers that you see here and the audio-video equipment, we create a virtual reality that draws the student in an immersive environment.
The student who enters the room will receive a report on the patient, and from that point on, they'll start taking care of the patient. They'll assess the patient, listen to the patient.
Sometimes in the sim lab, we're put into situations that we aren't prepared for. And you go in there and you do the best you can. And that's how you learn.
The mannequins we have here are medium fidelity mannequins in our nursing bay. That allows us to replicate heart sounds, lung sounds, bowel sounds. What we also have here is high fidelity mannequins, which allow us to replicate multiple functions during immersive simulations. The high fidelity mannequin has the ability to sweat, cry, salivate, have a runny nose.
It's amazing to see that you can have a mannequin who can talk, who can per se feel the way a patient normally would be, and it's a great learning experience.
The most important part of immersive simulation is the debriefing. The debriefing experience takes place immediately after the scenario comes to a completion. And this is a circle of trust. This is where the students feel safe amongst their peers to discuss what happened.
The level of expertise and the amount of confidence that they can get from the sim lab it's priceless. As a veteran in nursing, I can't even begin to imagine what a great advantage this is for these students.